Thermal ablation is a minimally invasive treatment for tumors in the liver and other organs like kidney, lung, bone. And in this type of treatment, we insert a needle or applicator into the patient from the outside interstitially, and then either heat or freeze the tissue. And this effectively destroys the cancerous cells and spares the normal tissue around. So this technique is widely used, especially for patients who aren't suitable for surgery, and there it demonstrates survival rates that are really comparable to surgical resection when performed with advanced ablation guidance software. And there we even see that it starts to compete with surgery. Ablation is part of interventional radiology or interventional oncology, which is a rapidly growing field that uses image guidance procedures to treat cancer. Globally, it's estimated to be used in around 20 to 25,000 hospitals and clinics, and this number is only expected to grow as it's expanding into new regions.
Image guidance is crucial in liver ablation because the liver deforms when inserting the applicator. Without intraprocedural imaging and precise tracking, it's challenging to ensure the applicator is placed correctly and that the whole tumor, along with the necessary safety margin, is treated. Traditional methods rely heavily on visual estimation, which increases the risk of missing parts of the tumor.
So this module is based on research conducted by MD Anderson Cancer Center as part of their COVER-ALL trial, where they demonstrated that using the biomechanical deformable registration provided by RaySearch for liver ablation treatment verification, it reduced the risk of local tumor progression. When a minimal ablative margin of at least 5 mm was achieved, the risk of local tumor progression was as low as 1%.
The module incorporates advanced deformable registration techniques that accounts for the biomechanics of the liver. Unlike rigid alignment techniques, this approach adapts to the deformation of the organ. This means that we can track where the tumor is located in the image, also when the image contrast doesn't allow us to see it.
By using biomechanical deformable registration, we improve treatment verification. This means that after the ablation, we can more accurately assess whether the entire tumor and necessary margins were treated, reducing the risk of recurrence. The workflow is designed to be intuitive and efficient. The module automates key steps such as segmentation and image registration, reducing the burden on clinicians. In the planning step, the clinicians plan the intervention to ensure total coverage of the tumor and its margins. Once the applicator is positioned, another image is taken for the targeting step. In this step, the liver is segmented and the tumor is mapped from the planning image to this image. This step can show if the applicator is correctly positioned or if adjustments are needed before starting the treatment. Finally, a verification image is taken. In this image, the liver and ablated areas are segmented and the tumor is mapped. This shows if the ablated areas fully cover the tumor.
When showing this module, people have been surprised on how fast the deep learning segmentation is.
It's been really exciting to take this brand new product into, for us, really new world of interventional oncology. So recently we've attended some of the big interventional oncology and radiology conferences, and there we met users and other people that work in this field. And there what we saw is that really so many people comment on how good the software looks and how polished our system is compared to the other systems that are out there. It's also really user-friendly with the workflow steps, so planning, targeting, verification. And then lastly, people are really amazed by how quick our computations are. And this is, I mean, of course, amazing to hear. But at the same time, it's in a way expected because we have so many years of experience in radiotherapy and all this knowledge, and even the software tools itself, we've been able to reuse in ablation. So this is really like bringing a seasoned product into a new field. And I mean, it doesn't feel like a first try or a prototype. It's really, I mean, a good product.
The module features an advanced deformable registration algorithm that have been rigorously tested and used in clinical radiotherapy workflows. This ensures more accurate tracking of the movement of the liver along with the position of the tumor, something missing in the often used side-by-side comparison of images by eye.
The module uses biomechanical deformable registration, meaning it doesn't just fuse the images by aligning them like it's done with rigid registration, but it considers the actual physical properties of the liver, making tracking and verification significantly more precise. A key goal is to make the workflow fully automatic with minimal user input. This means that clinicians can focus more on patient care rather than complex software interactions.
RaySearch specializes in software, and we have a deep history in radiotherapy. So we have our TPS, or treatment planning system, RayStation, which is used by over 1,000 clinics in the whole world. And there's, many people that have built these systems. So we have an R&D department with over 150 people, developers that have experience with, developing these AI solutions and bringing them to the market. We also have a machine learning department that releases DLS models or deep learning segmentation models. And those same people, they have built the ablation product. So we've really been able to reuse all of our knowledge and expertise to build this new product.
The key technologies in the liver ablation module, like virtual applicator creation and ablation zone estimation, AI-driven segmentation and deformable image registration, have great potential beyond just liver ablation. In the future, these technologies will be adapted for fully automatic workflows for tumors in other organs, like lung, kidney, and bone, where accurate applicator placement and treatment verification during the procedure are just as important.
As the match analysis continues to evolve, there is also potential for fully automated applicator guidance, allowing for more robot-assisted interventions. Future updates might include automated applicator detection and tracking, optimizing workflow efficiency and reducing reliance on manual adjustments.
As a company, we have a lot of experience from automated planning and optimization in the field of radiotherapy. Using this knowledge and experience, we look forward to innovating in the field of interventional radiology.
Beyond ablation, interventional radiology as a whole could benefit from the module's image-guided precision. It could be extended to vascular interventions, such as targeted drug delivery or tumor embolization, where precise localization is essential.
Our plan for the future is to have a full software suite in all of interventional oncology, so that on one side means ablation with all types of ablation and all types of tumors. And on the other hand, we also think it's a great idea for the future to move into transarterial radioembolization or TARE with the Y90 microsphere planning. So we think on one side it's really nice to have a full suite of software, but it also opens up a unique opportunity to bring the worlds of interventional oncology and radiotherapy closer together. Our vision is a world where cancer is conquered, and we think that the interventional radiologist really plays an important role in that and should be part of that journey. We also believe that the radiologist should be at the tumor board, and having a joint software solution will really help with that, we think.